With us on The Real Story, we are seeing a summertime surge in COVID cases fueled by the highly infectious Delta variant. The CDC recommending people mask up indoors regardless of vaccination status here in Connecticut. And recently, the Department of Public Health warned us about social gatherings that mix vaccinated with unvaccinated people, saying they should be outdoors. Indoor gatherings should include masks. That's after the state found several breakout cases of COVID-19 linked to 3 events: travel to Provincetown, Massachusetts, where there was an outbreak, a birthday party, and a summer camp. Health officials urging people to get the vaccine, saying that is the way to get this pandemic under control. Let's bring in Dr. Albert Koh with the Yale School of Public Health. Dr. Koh, thanks so much for coming back on The Real Story, and good morning to you.
Thank you very much, Jen, for the invitation.
All right, so what is the projection here? You know, it's disheartening to feel like we're moving backwards.
Yeah, so I think if there's anything that we've learned through this pandemic is to be prepared for the unexpected. If we go back, all the way back to, when we experienced first here in Connecticut, COVID-19, we remember the times that we learned about asymptomatic infection and that you could have transmission and super spreading. And now with the emergence of variants at the end of last year. And so this is, certainly, I think this is really what all public health is about, to prepare for the worst and hope for the best.
I mean, we're in a different place, though, than we were last year, right? I mean, people do have some protections. We have some people who are vaccinated. We know more about the virus, even though we have these variants that can change certain things. Are we in a better place?
Yes, we are in a very much in a better place. And what brings us or makes us, be in a better place has really been the game changer of vaccinations. This has been a remarkable public health success story on 2 fronts. One, that we have vaccines which are highly effective in preventing us from the severe complications, the hospitalizations and the deaths due to COVID. And the second is that really what the state has done in terms of vaccinating large proportions of our population. I believe we're up to almost over 70% of the population, the total population of Connecticut, that's received at least 1 dose of the vaccine.
What's so hard about it, though, is Connecticut can get as many people vaccinated as they want, and it still depends on the rest of the country and the rest of the world to do the same, right?
Yeah, and I think that shows us about how important the interconnectivity, that we're not an isolated state or an isolated community, and that really our public health is really dependent on the public health of others, in not only in our country but throughout the world. And the Delta variant, which emerged from India initially, is really a very good example of that.
Yeah, COVID knows no borders, right? These breakthrough cases, so we're hearing that like less than 1% of breakthrough cases are happening, but we continually are hearing about them. People who are well known, you might hear about them. We were just talking about it on the last segment. Senator Lindsey Graham had gotten a breakthrough case. I certainly have heard of several people in Connecticut that I know of who have gotten these breakthrough cases. Are they more common than what's being reported?
Well, I think we have to go back to some kind of first principles about vaccines. So the COVID vaccine is not like many of all of the other vaccines that we have. They're not perfect. What we do know, and what's important, is that people who complete the full regimen of vaccination, and this is, for example, 2 doses of the Pfizer vaccine or 2 doses of the Moderna vaccine. These people they're protected 90%. Protection against the severe complications such as hospitalization and deaths from COVID. In terms of getting ill or getting sick, that number is lower. That number may be as low as getting to 80% of the general population. And then the third thing that we have to think about is that this virus can infect people but not necessarily cause disease. And from new data from England, but in information from Israel, is that that's certainly not 100%, but it could be around 50 to 60%. So if we think about, let's say, a birthday party, as such as we had an outbreak here in Connecticut, but it's happening throughout. I'd say it's a birthday party of 50 people who have been vaccinated. If there one person who's unvaccinated and exposes all of the other 50, that vaccine, although it protects, tremendously against, the severe complications, hospitalizations and deaths, you will have people, for example, 5 to 10 of the people at that, birthday party who potentially who are vaccinated and get infected. So this is not a perfect vaccine, but it's an important vaccine in terms of saving lives.
And, it is concerning, too, because you're hearing that even if you're vaccinated, you could still spread the virus. Do you have less of a virus load? Like, how does that work? For example, I am vaccinated. I have a young son who isn't eligible for the vaccine. So my concern, of course, a lot of times is, could I be carrying disease to him?
Yeah, so this is one of the challenges, and why we're particularly concerned about the Delta variant. The good news is that our vaccines work well against preventing the severe complications of COVID, as well as getting ill or having symptomatic disease from COVID due to the Delta variant. We're still learning a lot about the question that you raised, which is a very important one, which is that are people who are vaccinated but infected, are they equally likely to transmit the disease? There is that outbreak on Provincetown in Cape Cod where where it appears that early evidence from that is showing that people who are vaccinated and been infected actually carry or shed as much virus as people who are unvaccinated. And that's certainly concerning. There's also other information that's coming out from England, just recently the other day from England, where it seems like, that people who are vaccinated who are infected, they may be shedding virus, but it may be less than what unvaccinated people who are infected shed. So the jury's still out on this. We need to really follow the evidence. There's evidence on both sides. But I think the bottom line is that this Delta variant is an important public health threat. We need to take it seriously. And we're going to need, in addition to vaccination, we're going to need to implement public health prevention that mitigates the risk of spread, such as face masks.
Yeah, let's talk about that public health prevention. Of course, if you don't have politics in play, if you don't have our economy in the play, and you're just looking at the science of it right now, should we be having more restrictions, including shutdowns, for example?
Yeah, and I think so let me come at this at two sides. The threat that we have is really quite remarkable and in some sense unprecedented. We have this new pathogen that emerged a year and a half ago, and within that period has doubled in its transmissibility, its ability to spread, and that's a real challenge for us. Actually, the Delta variant, is equally as likely to spread as many of the other pathogens that we're concerned about, such as, for example, hand, foot, and mouth disease, which children usually get, which is a highly contagious disease. So so that's the challenge that we're facing. Vaccination is really the key intervention. It will dampen the transmission. We know that it's maybe 50 or 60% in terms of reducing the risk of being infected from the Delta variant. I think so although vaccines are important, you're going to need something extra. And I think the first step is obviously face masks. We know that face masks are effective, and they're about maybe 30 to 50% effective in terms of reducing the risk of exposure. We're going to have to think carefully also about what happens when we, think about, for example, gatherings, whether it's birthday parties, but also in schools when we're having people, especially when they're unvaccinated, like kids who are not eligible to receive the current vaccines, what we're going to do there to mitigate the risk. We're going to have to go back and use many of the things that we learned worked here in Connecticut and throughout, the United States and the world in the past. We need to use that, bring back some of those tools to really to intervene in this new threat of the Delta variant, given its high transmissibility.
So should people in Connecticut right now, the CDC recommending, if you're in indoor public places to wear that mask? I know obviously you're going to probably agree with that, but what about, if you're with your family and you have a small birthday party and it's not outside? Are we at that level of concern where we should be looking at that, even if you're vaccinated?
So certainly there are two things that are important in terms of transmission that we know about, not only for the Delta variant, but for all of the SARS-CoV-2 virus. One is that this is person-to-person transmission, so proximity and contact is important. The second important thing is the issue of super spreading. This is a virus where 20% of the people who are infected, or less than 20%, are responsible for 80% of the transmission. So I think this is the proverbial outbreak example of the Rose Garden when President Trump got infected. And so if we go back to that, what are the things that are going to help reduce that risk? And this all has to be done relatively. So one is, gatherings, and gatherings where you don't know the vaccination status of everyone. Vaccinations are going to be important in reducing that risk, but when you don't know who's vaccinated and unvaccinated, that's an issue. The second is, of course, face masks. And face masks, we know are an effective intervention in preventing spread. Now, of course, these are, when you're at the home, the risk status of people, and obviously in small gatherings, I would say we know, for example, from a lot of the epidemiological studies that we've done, that the risk in the household if someone's infected is about 15%. So, monitoring your symptoms, getting tested quickly, the things that we've done in the past are going to be equally important, and then isolation and quarantine in that setting. But I think, of course, wearing face masks at home is actually an impractical, solution. This is really more to be applied when we're thinking about when we're at work, when we're in mass transit, or when we're in places where large numbers of people, and we don't know the vaccination status of people.
That makes sense. We only have about 20 seconds left at this point, but do we think this will ever end? I mean, it seems like it's just going to be ongoing, especially if the virus can mutate. And I know you only have, 30 seconds to answer this, but your take.
Yeah, I think there are two things important, what we can do locally and what we can do globally. Locally, the answer is a very simple one. Vaccination is the solution. And Connecticut has been a shining example here in the United States. We need to do that in all of our communities within Connecticut in vaccinating people in order to protect ourselves from Delta and future variants. The second is globally. We're an interconnected world. And we have to think that, the Delta variant is the best example. We had a variant that emerged during a large epidemic in India that has been transmitted throughout the world and now is affecting our lives here in Connecticut. Unless we're going to vaccinate the whole world, we're going to have repeat examples. The only way that we can get mutations and we can select for these mutations that potentially may escape our vaccines is if we don't go out and really prevent transmission throughout the world in providing supplies, adequate supplies of vaccination for places. And I'm particularly worried about Africa, Southeast Asia, South Asia, in Americas, where I've worked, in Brazil, where I worked for the last 30 years.
We know the World Health Organization urging countries to not give a booster shot until other parts of the world have been able to even get their first vaccines. I think that was last week that I remember WHO talking about that.
And Jen, that's a really important issue. And COVID has really emphasized this issue of social justice in the pandemic response. Unless we are able to equitably protect the whole world, we're not going to be able to protect ourselves here in the United States and here in Connecticut.
All right, Dr. Albert Coe, thank you so much for coming back on The Real Story. We very much appreciate your expertise on this topic. Have a good morning.
Thank you. Always a pleasure.
All right, that does it for us on The Real Story.